Hi guys, it's Erica from Reprieve, and as you may notice, we are not at Reprieve, and this is not Reprieve related. However, this is something very important to me that I wanted to share with you. I am going to be undergoing my second migraine surgery on April 24th, so I will be out of commission for a couple of weeks. And I wanted to introduce you to one of my heroes, Dr. Guyuron. He actually pioneered migraine surgery 25 years ago?
25 years.
25 years ago. So I'm hoping that this video and this knowledge can help one of you or someone you love, because I know there are a lot of people who don't even know that migraine surgery exists. So Dr. Guyuron, can you tell them a little bit about what is migraine surgery? Migraine surgery is
about elimination of the trigger sites. Where 25 years ago I discovered that the headaches start from certain parts of the head or face, and mostly is related to vessels irritating the nerves or muscles irritating the nerves. And if we remove those muscles and vessels, we can actually stop the cascade of events that ultimately results in sensation of fear of lice, fear of sound, of nausea, vomiting, severe headache. So started doing a lot of research. And
can you go over any risks and side effects that might come up?
We actually have done many studies, and every study that we did previously over the last 25 years, one of the components was looking into the risk. The first aim was to look into the risk to see if we are harming anybody. And fortunately, many of the side effects or risks of this operation are temporary, meaning numbness that is going to go away. Infection has been extremely rare. There's a condition called neuroma, which is the scar formation around the nerve. And we were fearful of that because it can be very uncomfortable, very painful. We really rarely see that, or we don't see that. It's extremely rare.
If you do see that, is it treatable?
It is treatable in most incidents. Okay. And infection can happen again, bleeding can happen. Those are very, very rare, very uncommon. We have actually documented those on essentially every clinical study that we were going after the efficacy and safety of the operation, and that's what we were investigating, and we couldn't find anything that was permanent and disturbing enough to say we need to stop this. Go ahead, point to the spot where the headaches start from. I'm just going to mark that, and I'm going to listen to that spot with an ultrasound Doppler. Okay, that's what I wanted. Exactly where you pointed to, there's a sound, there's a pulse sound. It means that the vessel is irritating the nerve there.
Yep.
And what I do for that is make a tiny incision on top and remove that vessel, free up the nerve. But that usually has a really high chance of success.
And then for this part, you go through here?
Yeah, I go through the incision will be in the eyelid. Some patients actually ask me to remove some of the redundant skin above the eyelashes also. That's the choice. But with or without it, the incision will be in the crease. And through that incision, I remove the muscles that are irritating the nerve.
Okay.
That